Good evening, everyone. A very warm welcome to all joining us live on this special occasion, World Thyroid Day. I'm Simran Choudhary from Voice of Healthcare, and I'm thrilled to be hosting this today's session, Thyroid Health in Today's World. Are we paying enough attention? So thyroid disorder often go unnoticed until they start affecting our energy, mood, metabolism, and more. So today we aim to bring more attention to this often misunderstood yet crucial aspect of our health. And who better to guide us than our esteemed guest, Lieutenant General Dr. Narendra Kotwal, President of Endocrine Society of India and Director of Endocrinology at Paras Health, Panchkula. With decades of medical leadership and clinical insights, he brings unmatched expertise to this conversation. Welcome to our show, sir. It's pleasure having you.
Thank you, Simran. Thank you very much.
Thank you so much, sir. So, without any delay, let's dive into an insightful discussion about the rise of thyroid conditions, especially in women, the myths surrounding them, and the way forward in detection, technology, and awareness. So, Dr. Kotwal, as the president of Endocrine Society of India, how do you view the current burden of thyroid disorder in India?
Thank you, Simran. As initially pointed out in your opening address, that there is a problem. Thyroid disorders are rampant, and it can be seen as a sort of a silent epidemic. Right now, in India, 50 million people have thyroid-associated problems. And one should understand thyroid is it's an endocrine organ which is present in front of the neck, produces various hormones. Now, problems can be either overproduction or underproduction of thyroid hormone. Both conditions can cause deleterious issues. If it is underproduction of the thyroid hormones, subtle things happen, which are taken as stress, work issues, other things, mood disorders, as you pointed out, and often are ignored. You'll be surprised to know 30 to 40% of the thyroid disorders are not diagnosed unless they come in the very late stages. So platforms like this are very important to create awareness about the thyroid problems. And as I pointed out, it can be functional problem or it can be structural problem. And sometimes we get ultrasonography done. We find some thyroid nodules is there. Then there is a scare whether it's going to be cancerous growth or not. So we ought to know what are the features which suggest towards the malignancy. And most of 90% of the times, these things are benign. Another problem which is thyroid is the rising use of various endocrine disruptors in our day-to-day life. We are seeing increased thyroid problems. Then there is a regional disparities in the countries. Our country is a huge country. Sometimes we find in Himalayan and other people there may be iodine deficiency, wherein others use of endocrine disruptors. So thyroid problems can be due to various underlying issues. Besides that, in urban areas also thyroid problems are increasing. Now, as a responsible society, Endocrine Society of India, we are trying to create awareness through various public platforms about the thyroid problems. Not only that, we will create a setup where we can empower young physicians or physicians in the periphery to take informed decision in treating thyroid problems. Plus, we'll carry on with our research to find out environmental autoimmune endocrine issues affecting thyroid health.
Thank you so much for answering that question, sir. And I think you said it right. Most of the thyroid cases come and notice at a very later stage. And I think that is some of the very important aspects we need to create awareness on this. So thank you so much for being part of this awareness session as well, sir. So what do you think thyroid issues? Why do you think the issues are rising in today's fast-paced urban lifestyles? Are we overlooking few of the early signs which we should pay attention?
Yeah, you rightly pointed out. Thyroid problems we see more in urban areas. So why it is so happening? Unfortunately, urban areas are exposed to various disruptions in terms of stress, diet, pollution, and so many factors. So we'll discuss one by one what are the various factors. First, let us take the stress. So whenever there's a stress in life, whatever the reasons, various hormones come into play. One is the cortisol. Now, what does this cortisol does? It disrupts the various functions of the thyroid hormones. The conversion of there is a called prohormone T4. T4 to T3 conversion is impaired. Besides, hypothalamus pituitary thyroid axis is disrupted. Then, looking at in urban areas, you will find that these youngsters these are taking fast food, which is high in calories but poor in micronutrients. Like there may be iodine deficiency, which is required for thyroid hormone synthesis, selenium deficiency, zinc deficiency, vitamin D deficiency, B12 deficiency. All these things are required for the effective thyroid hormone synthesis. Importantly, as I alluded to earlier also, use of plastics, heavy metals, cosmetics, all these things, especially microplastics, are called endocrine disruptors. They affect the hormones in a big way, not only thyroid hormones, so many hormones in our body. These are called endocrine disruptors. Continuous use of microplastics in our day-to-day life is one of the commonest cause of not only thyroid hormone problem, but obesity also. Then coming to the this thing that we find more obese people in urban areas. So obesity is a site of inflammation, like body में आग लगी हुई है, and this आग can disrupt the various thyroid functions. Not only that, you will find in the urban areas people using various medications, and all these medications can disrupt the thyroid axis. So unfortunately, in urban areas, people are exposed to certain things which is not good for thyroid health.
I totally agree, sir, because the kind of choices we have right now in market is not a healthy one. But unfortunately, like I said, the choices are very limited, and the kind of food which is available is mostly the one who kind of aggravate all these issues. So it in terms of urban lifestyle, it becomes very difficult to lead a healthy lifestyle because of the things are there in market. So I think why this could be one of the reason why this thyroid is rising in urban areas. So, sir, women are more likely to suffer from thyroid disorders. What are the key hormonal or psychological factors behind this?
Yes, very pertinent questions. As such, you see, almost 10% of the ladies have thyroid problems. And as such, ladies are very strong sex. They have strong immunity. But whenever there's a problem, that's immunity. Because of the strong immunity, that immune response is also more. So autoimmune thyroid diseases like hypothyroidism, Hashimoto-thyroiditis is more common in ladies. As such, because of the estrogen, this estrogen has an effect on the what we call the thyroid hormone receptor expression, various in axis, what we call the hypothalamic pituitary thyroid, it has got impact on that. So because of these hormonal uh, interplay between the estrogen and thyroid hormones, there can be propensity to have more thyroid disorders. And moreover, at the various stages of life, be it in the pre-pubertal stage, during puberty, during pregnancy, post-pregnancy, menopausal, at various stages, ladies are vulnerable to various thyroid problems, which we'll discuss subsequently.
So, thank you so much, sir. And sir, can you share how thyroid health affects women across different life stages from adolescence to pregnancy to menopause? Because I think these are the few very important stages, and hormones get a little up and down in these stages.
Right, right. This was I was alluding to. See, in children, like बच्चियों में, if there is a thyroid hormone deficiency, what happens? They may have stunted growth. There may
Yeah.
be growth disorders. It may affect their mental acuity. There may be delayed puberty. Even sometimes there is a sort of a precocious puberty also. And when they enter into puberty, both disorders, hypo or hyper, if it's a hyperthyroidism, there can be accelerated puberty, they start growing fast, but ultimately height may be less. Then during adolescence phase, once they are entering into puberty, there can be delayed menarche, there can be ovulation defects, there can be irregular cycles, depending on hypo or hyperthyroidism. If hyperthyroidism, there can be irregular bleeding. More often, there is a bleeding, menorrhagia. Then during pregnancy, even subtle thyroid dysfunction, what we call the subclinical hypothyroidism. There may not be clinical features, but even that subclinical hypothyroidism can affect various stages of pregnancy, that fetal development, because during the first trimester, thyroid hormones are very important for the brain development, for the bone development of fetus. So even the critical period, it can affect the child. Then it can affect in terms of the live births, miscarriage, preeclampsia, so many things. In pregnancy, one more thing I would like to point out, not only hypothyroidism, in fact, there is a hormone during pregnancy which is produced called HCG. Now, HCG has action like thyroid hormone. So these ladies may have accelerated functions like they may have increased pulse rate, persistent vomiting, weight loss, you see. And later on after pregnancy, there's a rebound immune phenomena. Some of the ladies may can go into hypothyroidism, or post pregnancy they may go into depression. It may be short lived, or it can convert into hypothyroidism later on. Then later in the life, during menopause period, there can be increase in TSH, and symptoms may be attributed that it's a normal aging process. So even that time, subclinical hypothyroidism can cause issues. One more thing I'd like to point out, during all these phases, even if it is not frank hypothyroidism, is subclinical hypothyroidism, it can affect various other functions also. Like lipids can be increased, cholesterol can increase. There can be sort of a depression, mental health issues. And moreover, young girls do have, especially in northern part of India, polycystic ovary disease. They are more prone to thyroid disorders.
Yeah.
Later in the life, even subclinical hyperthyroidism can, these particular individuals are more prone to arrhythmias, heart irregularities. So all these problems can occur. So it is very important to detect early not only frank hyperthyroidism but even subclinical hypo or hyperthyroidism.
Definitely agree, sir. But there could be some silent signs and symptoms which we do not, or a layman person do not understand what is going through, and that makes it necessary to visit your doctors timely. Whenever you feel there's something wrong, there's something changing in your body, you're not able to understand, then it's time to understand. So just clear off the mind. If there's nothing, then it is good. But if there's something, then you have that solution there with the doctor. So I think it is very important to create this awareness that people should not hesitate to go to their doctors. It is very important nowadays to go for the
Yeah,
regular
I
checkups,
just
even if there's nothing.
one tip in this is general principle in the life. Your body tells you. Your body tells you there's something wrong. If you feel your body is giving signal that yes, there's not something right. Now, for example, one is feeling fatigued, one is feeling slightly depressed, thinning of hair, slight weight gain, mood changes. These are not normal things. So I would request everyone, whenever such things happen, don't attribute it to the lifestyle changes or aging process. Please get yourself checked by your doctors.
A very strong message, sir. Thank you so much for that. Sir, like you've just explained, there could be some reasons and we delayed because of the lifestyle changes or the aging process or something like that. So there are many other misconceptions and myths around this. So what are some of the most common myths around thyroid condition that you encounter in your clinical or academic work till now?
That is a great question. Why I say great question? Because invariably thyroid is a punching bag for everything. For example, first number myth is that the thyroid problem occurs only in women. As we discussed earlier, thyroid problem is more common in women, but it doesn't matter. It does not mean that men do not have thyroid problem. In fact, because of the delayed in the diagnosis, men may have more aggressive problem. So both men and women can have problem, but of course, it's more common in women. Very important myth, which is the commonest myth, is that मेरा तो weight बढ़ गया है, thyroid is to be blamed. Yes, slight weight gain occurs in hypothyroidism, and in hypothyroidism there is weight loss. In hypothyroidism, weight gain is not more than say 3 to 5 kg or more than 10% of your weight. Any weight beyond that is not because of the thyroid problem; it is because of fat. In hypothyroidism, weight gain occurs because of the water collection. And if somebody is taking treatment, then this weight comes to your pre-weight before the thyroid problem. So any weight gain beyond that is the fat, and fat is intake versus output is energy balance. Similarly, there is a myth in a lot of people that हमने तो weight कम करना हम thyroid extracts लेंगे. No, that is the misuse of thyroid hormones. Then another myth which is very common है कि थायराइड हो गया तो लाइफ लॉन्ग हमको ट्रीटमेंट लेना पड़ेगा. यू सी, thyroid problems can be due to various underlying issues. Suppose if it is a thyroiditis, which is because of the infection, this is a short-lived thyroid problem. One does not have to take thyroid extracts lifelong. Then there may be drug-induced thyroid problem. Somebody like cardiac patients, they are taking drugs, amiodarone or some other drugs, immune checkpoint inhibitors. These thyroid problems are short-lived. So we have to find out what is the underlying cause of thyroid problem. Depending on that, it will be whether short-lived or long duration of thyroid problem. Another which is very common is that about the use of nutraceuticals. ये डाइट खाने से ये प्रॉब्लम हो जाएगा, ये डाइट खाने से थायराइड ठीक हो जाएगा ना, थायराइड nutraceuticals, cabbage खाने से, cauliflower खाने से, all these things. See, if you these things are called glycogens, but you ought to take these things in plenty, kg or something like that. If properly cooked food, it will not interfere with your thyroid problem. Then another myth is about the thyroid is कि हम तो दवाई कभी भी खा सकते हैं. Like if it is for hypothyroidism, you have to take it early morning, same time every day, and it should not be mixed with any other. I see a lot of patients taking their thyroid table along with the antacids, which interferes with the absorption of the thyroid hormone. So if you are taking thyroid hormones, it should be empty stomach, not to be mixed with anything. Some other problems are like ultrasound. We do ultrasound, we find thyroid nodule. Then there is a scare in the patients. ये तो cancer हो गया. As I told you earlier, most of the thyroid nodules are benign. There are certain characteristics of the thyroid nodules which point towards the malignancy, and which, of course, sonologists or your own doctors will tell you about that. But generally, most of the thyroid nodules are benign. Then another various other things that with the thyroid hormone, men में, these children में नहीं हो सकता. As I told you, thyroid deficiency in the children is one of the commonest cause of short statures, altered mental state. So these are the various myths about the thyroid hormones.
Definitely, sir. There are many other myths around in the world which we need to clear. And thank you so much for clearing some of it. And I believe social media and other things are also playing a small role in creating this misinformation and myths, because whatever information we see is not credible, is not authentic. We just go
Right.
on and believe it. So I think this is also creating one of the source of misinformation, but we need more of such sessions to burst all these myths. So
Right.
sir, how can we encourage individual to seek medical help rather than rely on self diagnosis or misinformation which is available? If you take this kada in the morning, mix it with this, and your thyroid will go away, your hormones will be stabilized again. All of this misinformation available.
Right. Firstly, the type of interaction which we are having, we ought to have this awareness programs more often. Such
So,
programs, it can be through the social media platforms. Not only that, what I feel is very important, we ought to have such sessions in the school curriculum, in the vulnerable groups. Who are the vulnerable groups? Our children, adolescent group, young ladies. There's sort of awareness program through the social influencers or various celebrities can give sort of tips that if certain symptoms occur, as we discussed earlier, fatigue, weight gain, thinning of hair, irregular cycles, depression, mood disturbances, one should get hormone testing. It's very simple. Just T4 and TSH, you get your test done and it will tell you idea about that. But important thing is that there has to be awareness, and awareness is possible whenever we create such platforms. It may be through your radio, television, YouTubes, or our social media platforms. And as I told you, in school curriculum, some talk should be there so that children become aware what are the problems and when they should get their test done, and when they can tell their parents, please get our test done.
very rightly pointed out, sir. I think that is the right stage where we need to educate our upcoming generation, the youth of our nation. I think that's how we can target the root cause there and then stop it there only if something goes wrong. Thank you for that point, sir. So, and how important is early screening in managing thyroid disorders effectively in India? And are we doing enough to this regard?
Early screening, for that matter, for any chronic disease is very important. We ought to detect any disease when it is in its initial stages. It's no point diagnosing disease when it is already advanced. As I discussed earlier also, there is thing called subclinical hypo or subclinical hyperthyroidism. Means People may not have frank symptoms, but there is a problem. Just to give you an overview, again to re-emphasize the point, subclinical hypothyroidism, especially in adolescent girls, it can cause various cycle disturbances. It can cause infertility in the pregnancy. It can cause the problem in the fetus. And at the same time, is a risk factor for cardiovascular diseases. And subclinical hyperthyroidism is a risk factor for the bone disorders, loss of bone, and arrhythmias. So we ought to do screening at a earlier stage where we can detect such things. So screening at earlier stage is very important. Now your questions, as a nation, are we doing enough things? So there's a concept of universal screening. All pregnant ladies should be screened for thyroid disorders. I am afraid that this is being followed to its true spirit. It's not being done. Then after 35, everybody should get their thyroid test done. It is not being done. Then for adolescent girls, thyroid testing should be done. It's not being done. There's a lot of disparity between urban and rural setup. Most of the people in urban areas get their thyroid test done, whereas rural population are not getting their test done. I feel these thyroid disorders ought to be integrated with the National Health Mission and with the other national non-communicable diseases. We ought to take up the case with Government of India that this should be part of National Health Mission, and in the broader context, universal screening should be done.
Definitely, so universal health screening should be done, and we believe with this kind of awareness sessions on every health aspect, on every health topic, we are creating this awareness. If we do not have a regular, annual checkups authorized by the government or regulated by the government, but we want to create that self awareness in every person out there so that they take this major step for their health, for their living, and for a healthy community out there, that every year they have to go for this regular body checkup, even if it is in rural area or an urban area. The system should be there, they can check all the parameters including the thyroid, and every other, the CBC count which it gives us, and the different parts of screening as well. So we want to have that thing, sir, and you are helping us in that mission, so thank you for that, sir. And what role do you see digital tools, wearables, tech, and telemedicine playing in improving this thyroid diagnosis and care nowadays?
In fact, digital tools have become our part and parcel of our life. In every day-to-day life, digital tools are helping us in a big way. And so is with the thyroid also. I'll just give you some examples. In hypothyroidism, monitoring is by simple test.
Hmm.
Patient sitting somewhere in lake, if gets a thyroid test done, he can send his TSH report through WhatsApp to his doctor. And doctors, after looking at TSH report, can adjust the dose of thyroid hormone. So simple it is. Patient need not go there. Then another, I told you about the thyroid nodules. So thyroid nodules, what we do as of now, as per the evidence-based medicine, we have to do sonography, then we do the biopsy, FNAC. Depending upon the FNAC, next step is done. Now there are AI tools based upon the ultrasonographic picture, which can tell you whether this is a benign or malignant, and so FNAC may not be done. So we can leverage that particular modality for not doing FNAC. So it is already being done in so many centers. Besides that, there can be thyroid tracker, now which can tell you about you have to take medicine at this time. These are the symptoms. Watch for the over or underdose of the thyroid. So all these things can help in a big way. So we have to make use of all these digital tools for the faster, smarter, and equitable thyroid health. And I think future is for the proactive digital ecosystem. We have to adapt this system to ensure good thyroid health.
Definitely, sir. The future is of digital, and because of this advancements, research, and the digital things which have taken place, the telemedicine kind of role, I think it has become little easier for the patients as well to reach to their doctors, and the bridge has been built up where the doctors can, directly advise or suggest their patients that this can be done from even far away. The example you just gave us. So I think this is something which is helping us a lot nowadays. So, as we are moving close to our discussion and we observe the World Thyroid Day today, what would be your key message to the general public and healthcare stakeholders to build a thyroid aware India?
So first and foremost is, please don't ignore bodies, whatever your body tells you. Listen to those signals of your body. Respect those signals. And small symptoms like, as we discussed, fatigue, lethargy, mood disturbances, depression, irregular cycles. Please don't ignore. Get your thyroid test done. Then, once treatment started, please don't stop your drugs. Don't bank on nutraceuticals and other things. Screen smart, screen early. As I told you, vulnerable groups, pregnant ladies, adolescent groups, we should try to do screening as early as possible to detect diseases at early stage. Then, once you have started the treatment, please keep on monitoring your treatment and please consult your doctors for dose adjustment. Very important. Lastly, I would like to say, this Thyroid Day, we should take it as a stepping stone to make India thyroid aware and thyroid literate. This is a public health problem. Not only public health problem, this is a child development problem, women health issues. So in that context, we have to take care of this menace of silent epidemic of thyroid problems. So I would say, listen to the thyroid whispers rather than its screams.
Thank you so much, sir, for this strong message and putting it ahead for our public for the awareness, uh, drive. And like you said, this is a child development problem, and nowadays it is very prevalent in our society. The kind of food habits, the lifestyle habits we have, and we ignore our health, and we keep everything else on priority rather than keeping our health there. So I think this is very important nowadays to keep check of everything, especially from an adolescent age where things are building up, the body is growing up into a adult, a youth. So thank you so much for all the message and
Thank you.
expertise you have shared with us. It's an honor to have you on our platform, sir. And as we mark the World Thyroid Day, so let's remember awareness is the first step towards prevention and care. Whether you're a patient, a caregiver, or healthcare professional, your role in spreading this right information matters to us. So thank you so much, sir, and thank you so much for coming to this session.
Thank you, Simran. I'd like to thank Voice of Health to give me this opportunity. Through this medium, I could reach to so many people. Thank you very much.
Thank you so much, sir.